Hello, thank you for visiting this training video hosted by DXC Technology. Today I'm going to show you how to enroll a new ordering, referring, or prescribing provider in the Provider Management module for Vermont Medicaid. Before we begin, please note that this video is intended for informational purposes only and does not guarantee approval of your enrollment in Vermont Medicaid. If you have further questions regarding Vermont Medicaid's enrollment criteria, please contact the Enrollment Department at DXC Technology at 802-879-4450, option 4, or email us at vtproviderenrollment@dxc.com. For today's presentation, I'm going to start on the homepage of the Provider Management module. You can access the link to the module by visiting www.vtmedicaid.com and click on the Enrollment tab. To begin a new enrollment in the Provider Management module, I'm first going to click on the menu button that's located on the top left-hand screen. Under that, I'm going to hover over Provider Enrollment, and I'm going to click on New Enrollment. Once you click New Enrollment, it's going to first bring you to the Welcome page of the Provider Management module. This just gives you some information that you may need in regards to your application. Once you're ready, you can hit the Start button located on the bottom right-hand side. Once you hit Start, that's going to bring you to the registration page. Each application is required to register in order to obtain a unique application tracking number, or referred to as an ATN, and an ATN you will need in order to resume an application that you could not complete in one sitting, or to check the status of your application once it's been submitted. So you're required to put in an email address and a password. You can choose to put in a provider reference. This is not required. This would just be informational for you to know which application you're currently on at any given time. Once you've entered in the registration information, you can click the Register button. Once you click Register, this is going to launch you into a brand new application. You'll notice that a blue box comes up, lets you know your registration is complete, and provides you with your tracking number, or your ATN. This ATN is also going to be sent to the email that you registered with, so if you want to write it down in order to reference it later, you can, or you can refer to your email for that application tracking number. A few things to note prior to beginning our application is the tracking number will present itself at the top of your application throughout the whole process. If you need page level help on the application, so you have questions regarding a page that you're currently on, there is a blue question mark located in the top right hand corner. If you click on that, it will give you more information regarding the page you're currently working on. If you need field level help, you have a question regarding a specific field that you're going to be entering, you can hover your mouse over the gray question box, and that will give you more information about what needs to be filled out here. Anything marked with a blue asterisk is required, and you'll not be able to go on to the next page and save the information without filling it out completely. So the first piece of information that I need to enter is the enrollment type. As stated in the beginning of this video, I am going to be doing an ordering, prescribing, referring, or attending application, or an OPRA application, so I'm going to choose that. Once you choose your enrollment type, you're going to receive a blue warning box, and this is just letting you know that once you save the first page, the first general information tab, you're not going to be able to go back and change the enrollment type. So you want to make sure that you select the right enrollment type for what you are trying to do. So then you can hit OK. The next piece of information that you'll need to enter is your provider type. So I'm going to choose from the drop-down list, and today I'm going to be a physician. And once again, when you choose your provider type, it's going to give you the same warning that once you navigate past this first page and save the information, you'll not be able to come back and change the provider type. The reason for this is you'll notice that once I entered in the information for my enrollment type and my provider type, it populated all of these panels at the top. These are all the panels that are required to be filled out with all the necessary information for an OPRA provider who is a physician. So this is the reason why you cannot go back and change it, because once you saved it, the application moving forward is tailored to those two pieces of information. The next piece of information that I need to enter is my effective date. You can request an effective date that is up to 1 year in the past or up to 90 days in the future. Under that, you're going to give us the provider information. So you're going to enter the last name and the first name, The gender and the ethnicity are not required. You can choose to enter that information or not. You are required to enter in a birth date. Because this is an individual provider, you do need to enter in the Social Security number. And you will be required to put in the NPI of the provider. Once you've entered in all that necessary information, you can move on to the 3 questions located below. The first question is, are you currently enrolled as a provider? If you choose yes here, a red warning box is going to come up and it's going to ask you, are you actually here to revalidate? If you're currently enrolled and you do need to revalidate, this wouldn't be the correct avenue to do so. That is a separate process. So if you chose yes, that you are here to revalidate, it's going to bring you back to the home page in order to start that revalidation process. We're not here to revalidate today. We are going to do a new enrollment, so I'm going to hit no and then change my status back to no. We're also going to ask if you were previously enrolled as a provider. If you choose yes, you will be required to give the previous 14-digit service location identifier for the provider. Last but not least is, are you Medicare enrolled? If you choose yes, you'll notice that no information comes up for you to enter. However, because we chose yes, later in the application, we will be required to give the Medicare information. So I'm going to leave that as yes today. Under those questions, you will be required to select from the drop-down the following programs that you are enrolling in. Currently, Vermont Medicaid only has one choice, which is fee-for-service only, so you're going to select fee-for-service. You're going to need to give us your contact information, and this is the information for whoever we should contact regarding this specific application. So if we had questions on the enrollment or we needed to send a notification out to get more information, we need to have that information here so it goes to the right person. You'll notice that once I entered in the address and tab through the zip code, it runs through the United States Postal software to validate that address. And it will yield results for any recommendations for changes. So for instance, in this case, it has added the last 4 digits of the zip code to my address. I'm going to accept those changes today by simply clicking in the line item. However, if you did not want to accept the changes, you do have the option to hit the X at the top right-hand corner. Next, I'm going to put in my phone type, and I'm going to select today that this is my work number. You have the option to enter in an extension or fax number, but they're not required. Now you'll notice as I'm entering in my email address here, it does not have a blue asterisk next to it, and that is because if I choose mail as my preferred communication down below, I would not need to enter in an email address. However, if I choose that my preferred communication is email, I would not be able to navigate and save this page without entering an email address here. We do recommend that your preferred communication is email, as you will get notifications regarding this application much quicker via email. So this brings me to the end of the first general information page, and I do have the option now to save and continue. However, before we do so, I just want to reiterate that at the top, the enrollment type and the provider type are 2 pieces of information I will not be able to change once I hit save and continue. So if you find out later down the application that you chose the wrong enrollment type or provider type, you would need to start the application over. I know for today that those are correct, so I'm going to hit save and continue in the bottom right-hand corner. This is going to bring me to the second panel of our application. So you'll notice that the first panel, the General Information tab, is now white. That means that tab is completed and we've saved the information. So I have the option to go back to it, review it, change it if I need to, except for the provider type and enrollment type. The panel that you're currently on is yellow. And any panels that you have not yet completed are indicated here in blue. And you'll notice that I can't skip ahead. I can't go on to, say, number 6 from here. I have to go in order by 1, 2, 3, and 4. I can't skip to the end and go back. So we need to enter in a specialty, and at least one specialty needs to be made our primary specialty. You'll notice my provider type is listed here. So I need to make a new entry for my specialty, and I'm going to do so by hitting the Create New button on the right-hand side of this panel. I'm going to check the box that this is my primary specialty, and I'm going to drop the box down to choose from a list of specialties. This list of specialties is driven from the provider type that I chose. So the module is made to be intuitive to my choices. So because I chose 005 for a physician, I'm only going to see the specialties that are allowed with that provider type. So for today, I'm going to choose general practice. Next, I need to enter in my taxonomy, and just like the specialty, the taxonomy is driven from the specialty itself. So I'm only going to see taxonomies that are related to general practice. So I'm going to drop the box down, and I'm going to select acute care. Lastly, I need to put in my effective date, and once I've entered in that information, I can hit save. Now you'll notice that I have an entry in this panel. I've made a primary specialty. If for some reason I realize that a piece of information was incorrect and I wanted to change it, there is a pencil icon located on this panel. A pencil icon in the module means that you can edit the information. So if I was to click on that pencil icon, it's going to bring up my entry and it will allow me to make changes as needed. So I could say I accidentally chose the wrong taxonomy and I meant to choose this acute care taxonomy instead. I can then save that information. If you had more specialties, you would simply repeat the process and you just wouldn't choose Make Primary. Once you've entered in all of your specialties, you can hit Save and Continue. The next panel that this is going to bring us to will be the Addresses panel. The first thing that I'm going to enter will be my service location information. So I'm going to put in my billing name, and I'm going to just enter that in as my provider name. And I need to provide the contact information for the service location. So the person that you enter here may be different than the one from the beginning contact information, as that was the contact information for the application, and this would be the contact information for the service location itself. So once I enter in all of this information, you're going to see that it's going to run through that USPS software again. Every address in the module runs through that software. So I'm going to tab through and it's going to process and it's going to give me any suggestions and I'm going to accept them. Next, I need to put in an email address for my service location and I'll need to confirm it. It is required under that you enter at least one phone number. So I'm going to do that by hitting Create New. And I can choose from a list of different phone types. Today I'm going to go ahead and choose work. And I'm going to enter in my work number. And if you have an extension, you can enter that here as well. And then you can hit save and that will create an entry. If you had multiple phone numbers that you wanted to provide to us, say a work number, a fax number, you could simply hit create new again and make a new entry with a different phone number. The next piece of information is regarding the service address itself. First, you're going to check the box for hours of operation and let us know what hours your service location operates at. So again, you're going to hit the create new button. And you have a multitude of different options here to tell us your hours of operation. So if you drop the box down, you have the option to choose that you're open every day. You can choose that you're open just certain days of the week. You can choose weekdays or weekends, as well as different times. So you could say you're here every day for 24 hours if you were a hospital, but if you had specific times on Monday that you worked versus Wednesday, you could note that as well. So for today, I'm going to say that we are open on weekdays, they're standard Monday through Friday. And I'm going to say that we are here from 8 o'clock in the morning until 5 o'clock in the evening. And then I'm going to hit save. And there is my entry. And again, if you had multiple entries, so Monday you work certain hours and Wednesday you work certain hours, those will be multiple entries. You would just simply hit create new again to make that extra entry. Under that, we're going to ask you if the service location is ADA compliant. Is the service location accessible by public transport? And then what are your after hours arrangements? So if you are not open all the time, what do you do in the event of when you're not open? So for today, I'm going to say we would recommend they go to the emergency room, but you could also note here that you have an answering service. And if you do have an answering service, you could provide us the phone information down below. The next address that is required is the mail to address. So you have two options here. The first option would be to state to us that the mail to address is the same as your service location. If it is, you can simply click this box and it's going to populate the information for you so you don't have to re-enter it. If it is not the same, instead of clicking that box, you would simply fill out the information for that address information. You can also choose for the mail to address, is the preferred communication the same as the service location? If it is, you can click the box and it's going to populate that email address and the phone number. One thing that I do want to note is for the mail to, when you hit same as service location, it's going to pre-populate the preferred communication to mail. You just want to make sure that if your preferred communication is email, that you check that over to email. And again, that is the recommended communication method. It is the fastest. After you filled out the mail to address, you can hit save and continue. The next panel that populates is the service location information. So this is information you're telling us about the specific service location that you are practicing at. The first box that you can check is stating that you accept new patients with special needs. So if you do, you can simply check the box. If you have any age restrictions at your practice, you would want to check this box and then give us those age restrictions, the minimum age and the maximum age. So I could say that I accept patients from age 18 to say 105. If you don't have any age restrictions, you would simply not check the box. You do need to let us know if you're accepting new patients. So you want to drop the box down and you can state either that you're accepting existing patients only, family members only, or you're accepting new patients. You can also let us know what the preferred patient gender in your office is. You have the option to choose from female, male, transgender, or no restrictions. Lastly, on this page, there is a option to opt out of the provider directory. If you choose to check this box, what that means is that you will not show up on our provider lookup for our members. We do highly recommend that you don't choose this box so that members looking at providers that are enrolled in Vermont Medicaid have the complete information that they need. Once you've finished all the service location information, you can hit save and continue. The next panel of the application is the associations panel. This is where an OPRA provider can let us know what facilities they are associated to. So you're going to do this by hitting the Create New button in the group association. And when you do that, it's going to ask you for a provider ID. This provider ID is the 14-digit service location ID associated to the facility that you are associating with. If you do not have this provider ID, it can be found on the vtmedicaid.com website under Provider Lookup. So I'm going to enter in my 14-digit ID of the provider that I am going to associate with. And you'll notice that when I put in that provider ID, it will come up with the business name automatically. You'll need to tell us the effective date and the end date of the association. So I'm going to say the effective date is 6/1/19, and I don't know our end date. So if you don't know the end date, if there is no end date associated, you can simply put in the end of time. After you entered that information, you can hit the Save button. And you'll notice that I now have an association to the Sparkling Waters facility. If you have multiple associations, you would simply associate yourself to each service location ID that you have. You can make unlimited amount of associations, so you want to just associate yourself to each facility that you are going to be practicing at. Once you've entered in all the information, you can hit Save and Continue. The next panel we're going to fill out is regarding credentials. So the first piece of information I'm going to need to fill out will be my license information. I'm going to hit Create New to make a new entry under License. I'm going to start by adding my license number, the issuing state, the issuing board, the effective date, and the end date of my license. Once I enter all the information, I can hit Save. If you hold multiple licenses, you can hit Create New again and just repeat the process and enter in another license. Under the license information, we will ask you if you're enrolled in any other state Medicaid programs. If you choose yes, you will be required to fill out the details of those other programs. You'll have to give us the program, the state, the effective date, and the end date. If you are not enrolled in other state Medicaid programs and choose no, that box goes away and you can move on. If you hold the DEA, you can enter in that information here. You would hit Create New, enter in the DEA number, the effective date, and the end date. And then you can hit Save. I did want to show you what happens if you put in information that the module does not expect in its requirements. So for instance, we know that a DEA is 2 letters followed by 7 digits. In this entry, I have 2 letters followed by 4 digits. So it didn't recognize this as a valid DEA number, and it will stop you and not allow you to go forth. The reason for this is we want to make sure that when you hit Submit of your application, that you've entered in all the necessary information so there aren't any holdups when it comes to processing your information. So I'm going to add the other digits to this, and now I can hit Save and it will process through. Once you've entered in all the information under the Credentials tab, you can hit Save and Continue. The next panel we come to is the Other panel. And the first piece of information we're going to fill out is any languages that are spoken at this service location. So I'm going to hit Create New, simply choose from a drop-down list of selected languages, and hit Save. If you had multiple languages spoken at your service location, you can simply repeat the process as many times as you would like. If you hold any certifications, you could let us know about those certifications here. You would just tell us the specialty the certification applies to, the certification type, number, and the effective date and end date. If you have a website for your service location and you want to provide that to us, you can enter in that URL here. This is not required. However, if you do enter it in, you want to make sure that it begins with HTTP or HTTPS in order for it to be a valid URL in the provider management module. You are required to give us your malpractice information. So we're going to hit Create New on the right-hand side in order to start that entry. First, you're going to let us know the type of carrier, whether it's professional liability or general liability, the name of the carrier, the policy number, the aggregate coverage amount, and the per occurrence coverage amount. Now you'll notice that I did not put any special characters in the coverage amounts. The provider management module will not accept any commas or decimals or dollar signs, so you do want to just stick to numeric entries there. You must put in the effective date and the end date of your coverage. Once that's all filled out, you can hit Save to continue. Under the malpractice information will be a question regarding if you currently have or within the last 10 years been involved in a malpractice suit or claim. If you choose yes here, a box is going to open and require you to give us more information regarding that suit or claim. You will be required to give us the plaintiff information, the policy number, and the status of your case, or the plaintiff information and the status of your claim. If this does not apply, you can simply hit no, that box is removed, and you can move on. We would like you to identify all medically related organizations in which the provider has ownership. This could include laboratories or home health agencies. So if this applies, you want to simply hit Create New, make the entry, put in the name and the address information. Once you've completed all the information on the Other panel, you can hit Save and Continue. The next piece of information we're going to fill out will be disclosures. It's important that you read the disclosure details, including the Privacy Act notice statement and the ownership and controlling information. For an OPRA provider, the only disclosure form that is required would be the provider self-disclosure form. It is required that each provider self-discloses. You'll notice that currently the status is in a new status, and we want that to be in a completed status in order to move forward. To do so, you want to hit Create New, and this is going to bring you up a self-disclosure form to fill out. You'll notice that my information is populated at the top. This is the provider name along with the social security and date of birth. All of the questions related in the self-disclosure form are pre-populated to say yes. It is very important that you go through each and every one of these questions and answer appropriately. This first question, for instance, has an answer of yes, and if this was a true yes answer, you'll notice there is a box directly below the question where we would require that you give us more information as to why you answered yes on this question. I'm going to go through these and answer the questions appropriately, but again, I do want to remind you just to make sure that you read each question and state it appropriately and answer it appropriately, because there are instances where you may have to answer yes or no based upon the question itself. So once I've gotten through these questions, it's going to ask me for a contact information in the event of an audit. So again, this contact information may be different than the previous contact information we have asked you for during the application. This is in case there is any audit, we want to know who would be best to contact in that event. I'm going to put in the address, and again, it's going to go through that USPS software to verify. I'm going to accept the changes, and then I'm going to put in my phone type. Under that, we're going to also ask you for the address for the physical location of the records. So again, this may be a different address than you have put in before. It may be different than your service location address. We would like to know where your records are held physically. Where are they? It's going to verify through that USPS. And then we're also going to provide a phone type of where would we contact in the event we needed to ask for medical records. Under that is a question, and I really wanted to take a moment just to note how this question is worded. This question states, in accordance with 32 VSA, I declare that I am currently not in good standing with respect to any and all taxes due. So that is saying that if you choose yes here, you're telling Vermont Medicaid that you are not in good standing with your taxes. So I'm going to choose no here, and I'm stating that I am in good standing with my taxes. So this is why it's very important to read each question very carefully. I'm going to finish up the rest of these questions. And once you get to the end, you can hit save. And you'll notice that once we hit save, it's going to bring you back to the disclosures panel. And you'll see now my status is completed for my provider self-disclosure. Now that it's completed, I'm free to save and continue to move on. The next panel that we come to is the attachments panel. This is where we state what is required to attach to your enrollment application in order for it to be complete. For a provider type of physician with a specialty of general practice, it is required that this provider provide us with a W-9 form, a professional license, and a proof of professional liability insurance. You'll notice that none of the requirements are currently met, and in order to move on, we need to meet these requirements. To do so, we're going to come down to the panel below under Attachment Details, and we're going to hit Create New in order to start a new entry. The first thing that you're going to do is tell us how you are going to get these attachments to us. You have the option to send it by mail, electronic only, email, or by fax. We highly recommend that you choose electronic only and upload your files right to your application. The reason for this is if you do so, once you hit submit, your application is automatically sent through the screening service and is put into a queue in order for DXC and the state of Vermont to process your application. If you choose by mail, email, or by fax, you have 14 days to get us that information. If the information is not given to us within 14 days, your application is locked and you would need to start over with a new application. So it's going to be much faster in order for you to get your attachments electronically versus having to send them in another way. but you do have the option, so you want to choose your transmission method. So today I'm going to choose electronic only. And then again, I need to action each requirement above in order to meet the requirement itself. So under attachment type, I'm going to first choose my IRS W-9 form. And then I'm going to go select the file on my computer for my W-9 form. I'm going to hit open on my computer, which is going to upload the attachment right into the application. Since it's now done, I can hit save. And now what you'll see is an entry down below under attachment details. I'm saying I sent it electronically. This is my IRS W-9 form, and here is the file itself. And you'll notice up at the top under required attachments, the IRS W-9 form requirement has now been met. I do want to just make note that a yes requirement met does not indicate that you've uploaded the attachment. It just indicates that you've actioned it down below. So even if you chose mail, email, or fax, it would still say yes at the top for the requirement met. You would just need to make sure that you sent those in after you submitted the application. So I need to go ahead and do my professional license next. So again, I'm going to hit Create New. I'm going to choose to do it electronic only because I know that's the fastest way. I'm going to choose Professional License, and I'm going to go grab my file off of my computer. It happens just that fast to upload. Now that it's done, I'm going to hit Save. And lastly, I need to upload my proof of professional liability insurance. So I'm just going to repeat the process. I'm going to hit Create New, select Electronic Only, select Proof of Professional Liability Insurance, and go grab my file off of my computer. I'm going to hit Save. Now I have 3 action items, and all of my requirements have been met. Now that all my requirements have been met for my attachments, I can save and continue and move on to the last page. So the last page of our application is the Agreement Submit page. You want to make sure that you read the terms of the enrollment as it states here. It's going to pre-populate the provider information here based upon the information we gave at the beginning. The top section here is letting you know that there may be provisions with the provider type associated. So you want to make sure that you click on this link first, and that's going to bring you to the vtmedicaid.com website, and you're going to look for any provisions that are associated to your provider type. It's important for you to read over those provisions so that you're familiar with them as you are agreeing to the terms of those provisions as well. Once you've reviewed the information, you can hit Proceed. Once you hit Proceed, it's going to bring up the General Provider Agreement. It is very important that you read over this provider agreement very carefully. You do have the option to print it or to download it. If it's easier for you to read that way, you can print it or download it onto your computer. Once you've read the General Provider Agreement and agree to it, you're going to click the I agree button at the bottom right-hand side. You're going to confirm that you agree it. And now you'll see I have a check mark next to I accept the terms. Under the General Provider Agreement, you're going to give us the portal registration details. This is the information you're going to use in order to register for the provider portal in order to maintain your information. So upon the approval of your application, you will be sent an email to the email address provided here with an invitation code to be able to register your provider in order to maintain and manage their information. Under the provider portal details is the signature, so you're going to sign this electronically. The first step to do so is clicking the I accept button. You're going to enter in your last name and your first name. If you have any comments that you want to provide to DXC or to the Department of Vermont Health Access, you could enter them here. The last step prior to submitting your application is to verify your email ID. So you want to enter in your email address, and of course you have to confirm that just to make sure that the email address is correct. And then you can hit Request Verification Code. I want to be clear that once you hit Request Verification Code, you will have 10 minutes to use the code that comes to your email before it expires. So you really want to hit Request Verification Code when you are ready to submit your application. If you are not ready to submit your application because it needs to be reviewed or you want to just finish it at another time, you have the option to hit Finish Later, and that will send you out of the application, and you can use your application tracking number that was assigned in the beginning, along with the password that you used when you registered, to resume your application. I am ready to submit this application today, so I'm going to hit Request Verification Code. It's going to tell me that the verification code was sent to the email address that I provided. And you'll see how fast this code comes to you. I'm just going to go ahead and pull this up. It's already come to me. So I'm going to just put in the verification code exactly as it looks in my email. So if there is a capital letter in my email, I'm going to put a capital letter in my verification code. If I was to say put a lowercase h here instead of an uppercase, it's not going to accept that code. Once you've entered in your verification code, you'll notice that the Submit button has opened up, so we are now ready to submit our application. Once you hit the Submit button, you are going to have to confirm, do you actually want to submit this application? Yes. It's going to process through, and then it's going to give you a confirmation. It's going to tell you have successfully submitted your provider enrollment application. It's going to give you your tracking number one more time. And again, this is in your email that was sent to you at the very beginning. It's also going to provide a cover sheet. In the event that you chose that you wanted to send us your attachments by mail, by email, or by fax, you would want to access this cover sheet and send it along with your attachments. This will just make it easier for us at DXC to identify where these attachments should go. If you would like to print your application, you do have the option to do so. You would want to click the print button that's located in the top right-hand corner, and this is going to create a PDF of your application, and you can either print it or you could download it to your computer. If you have any questions after you've submitted your application, we do provide the provider enrollment team contact information, so you can feel free to email us or call us at any time. Thank you for visiting this training video. Have a wonderful day.